Good morning, everyone. I am Press Secretary Philomena Robertson. Thank you so much for joining us for this week's post-cabinet press briefing. Members of the media, good morning to you. And thank you as usual for joining us and for the work that you do in constantly sharing information with the public. A special good morning to Richard Beadle of Caracou Vibes FM, who's joining us for the first time. To members of the listening and viewing public, thank you as always for tuning in to a reliable source of government information. It is no surprise this week that we are again focusing on COVID-19 as the rate of infection here in Grenada continues on the rise. In fact, we have experienced an exponential increase in the number of confirmed cases. This morning, at the head table, we have Minister for Health and Social Security, Honorable Nicholas Steele, Director of Hospital Services, Dr. Carol McIntosh, and the Permanent Secretary responsible for Hospital and Community Services, Hannah Julian St. Paul. Good morning to all and welcome. You'd recognize, members of the media and the viewing public, that the panel is different to what was shared by the Government Information Service yesterday. And that is so because the medical fraternity experienced a sudden loss this morning, not COVID-related. And both Dr. Donald and Dr. Charles are impacted by the loss of their colleague. They are human beings, first and foremost, and therefore we need to allow them time to come to terms with this loss. I therefore crave your understanding. I take this opportunity to extend condolences to the rest of the medical fraternity and also to the family of the late doctor. May he rest in peace. I'll go first to Minister Steele this morning to speak further along this line. Minister?
Thank you, Philomena. Good morning to all of our viewers, listeners, members of the media. Let me start by offering my sincere condolences, thoughts and prayers to the family of Dr. Davilry, who passed away earlier this morning. Dr. Ray has been providing yeoman service in the Pediatric department and is one of our stalwarts. I recognize Dr. Ray for his contribution as well and volunteering in giving support in our coordination with Martinique. And I want to say that Dr. Donald would have been, before she became medical director, she was head of pediatrics. So would have had a very strong working relationship with Dr. Ray as well. So too Dr. Mariana Charles, and that is why I'm sure you will understand that they are not here. They are, while they are also in our thoughts and prayers, they are, as when I last spoke to them, on their way to give support to the family of Dr. Ray. So keep us and keep them in your thoughts and prayers. Dr. Ray was 33 years old, and much more to give. We will move on too, though, because there is still the urgency and emergency of COVID-19, despite the fact that we have lost one of our soldiers. So I will now pass on to our PS Hannah Julian St. Paul, who will give an update, a status update as to where we are with respect to COVID-19.
Good morning. Good morning to the media, to the listening public. As the Permanent Secretary with responsibility for hospital services, I would like to take this opportunity as well to express our sincere condolences to the parents, family, friends of Dr. Ray, also his colleagues within the health system. It is a sad moment for us within the Ministry of Health, and by extension, the Pediatric department has been affected, and we will continue to see a void within the department as a result of losing our dedicated doctor in the form of Dr. Ray. A COVID-19 situation update and Ireland. To date, Grenada has recorded 1,473 confirmed cases of COVID-19, of which 267 have recovered and 1,194 cases are currently active. Of the active cases, 9 are imported and 1,185 are local persons. I would now give a breakdown of the active cases in terms of gender, age range, and vaccination status. 54% are females and 46% are males of persons affected. The age range from 2 months to 92 years old. 10% of the cases are within the age group 18 to 60. Sorry, let me go over. 10 to 84% are within the age group of 18 to 60, and we have about 6% are over the age of 60. The vaccination status are 80% of these persons are not vaccinated, and 15% are fully vaccinated, with 5% receiving 1 dose of a second dose vaccine regimen. The cases are within our Tri-Island state and Carriacou and Petit Martinique. So every one of our parishes and Carriacou has positive cases. Grenada has recorded 12 deaths cumulatively, with 7 deaths occurring on September 5th. Before I go any further, I would like to extend our deepest sympathy to the family and friends of the deceased, given this difficult period that we all are going through. The 7 cases occurring on September 5th, the deceased, all of which had comorbidities, which included asthma, diabetes, hypertension, chronic kidney disease, and cancer. These cases were confirmed as COVID-19 deaths, ranging from an age group of 26 to 85 years old. 3 were under the age of 45, and 4 over the age of 45 years. 5 of these deaths were among patients admitted to General Hospital, with 1 death at Princess Alice, and the 7th person died at home. 4 of these deaths were female and 3 were male. Of the accumulative deaths, 11 of the deceased were not vaccinated. The 1 case that was fully vaccinated was a 97-year-old who suffered from diabetes and hypertension. In the past weeks, the daily new positive cases ranged from 78 to 281. Yesterday, we recorded 231 new positive cases. Currently, there is a total of 1,194 persons in isolation and 560 persons in quarantine facilities throughout the island. As it relates to our vaccine uptake, at present, there is 27,046 persons have received our first dose vaccines, and 19,482 persons has received the second dose of vaccines. Therefore, they are considered fully vaccinated. And if I were to share with you a breakdown of the percentage of persons vaccinated within our parishes, St. George's has a percentage of 72.9%, St. Andrew 8.4%, St. David's 3.8%, St. Patrick's 5.2%, and St. John's and Mark 40 4.6%, while Carrick-1 Pity Martinique has a 5.1%. To date, we have conducted over 62,370 PCR tests. So that is the breakdown for our COVID-19 situation on Ireland.
Thank you very much, PS Julian St. Paul, for that breakdown of the statistics as it relates to COVID-19 in Grenada. I'll go now to Dr. Carol McIntosh, Director of Hospital Services. In recent days, we have certainly seen an increase in the number of persons who are hospitalized of COVID-19 positive persons coming into the hospital. I know there are limitations as far as our facility is concerned. Can you give us a sense of what the situation is now?
Well, first, let me just say good morning to everyone and to recognize our panel. And again, I apologize for my appearance, but this is telling you what's going on at the hospital, that we are constantly on the ground and pushing. Before I even start in about talking about COVID, which is right on us, I do want to again recognize and give condolences to our doctor that has died. Condolences to the family, because that is the most. But then there's also condolences to our hospital family. And this is even outside of the medical physicians as well, because he was one that is recognized across the board. And all people across hospital services are feeling devastated. And it feels even more so because one of your own has died. Even more so because within the midst of COVID, where our own hospital staff is out sick and we are being hit constantly, but continue to push, because our primary purpose is how do we make sure that we help to keep this country healthy as well as ourselves and our family. So I just wanted to recognize what is going on amongst us. As it relates back into the hospital, as you said, that there have been many cases that have been admitted with COVID-19 positive, and that would be at the General Hospital, but now we're hitting at some of the other hospitals as well. Princess Alice Hospital has 3 patients which they are managing, as well as Princess Royal is managing those who may come in for admission before transfer. Mount Gay has prepared if they need to manage, and we are all making sure that we are up there. I bring us back down to General Hospital. We start off with where we had the isolation ward that was in place for 9 beds. But as you can see, this is a disease that is moving, that is exponential. And so we have to make sure that we keep up with this. We have been fortunate that with our 9 beds, we were able to manage admissions. But now that we have more and more admissions, we had to enlarge to be able to manage patients coming in, those who are most critical and those who have COVID disease but have the other comorbidities that need to be managed. And so at this present time, we've developed the 2 additional isolation wards, which would allow us for a maximum capacity of 49 beds. And that's when it is at its max. We're putting all of the beds in. We're presently working with the fact of 34 beds ready for our admissions. We know that we now have 25 patients at the General Hospital that are being treated in a variety of different levels with COVID-19 and the comorbidities. It is overwhelming, and it is not something that is unique to Grenada. It is overwhelming for all of us across the place. So again, as we all know, we have all of these. We have our 2 wards at a capacity. We're looking at all doing that we can and have the variety of statistics that are present.
Thank you very much, Dr. McIntosh, for updating us as to the current situation at the General Hospital. Minister Steele, a tough time for frontline workers, a tough time for policymakers who have to drive the decisions that guide what happens on the front line. What can you tell us this morning, sir?
I know. What we need to do right now is to recognize the team that's on the front lines, the work that they're doing. That in some cases, as is a prime example, they are also dealing with their own personal challenges. As we just announced, we lost one of our own soldiers, not to COVID, but there are many of our frontline workers, many of our nurses, and doctors, because they live in the very communities that are affected, who also are in isolation, or who also have family members or themselves have tested positive. So like every single institution in Grenada, we have also been touched by COVID-19 immediately, because that's how quickly this spreads. Once it's in our communities, all of us who live in our communities become affected by it. So we need to understand that the Ministry of Health and our healthcare providers are no different. So cooperation and tolerance and understanding, first and foremost, is what I would ask of everybody. A recognition that this disease spreads in a certain way. And if we take the necessary precautions, we can prevent the spread. Thirdly, that we have to learn to live with this. We have to recognize that Grenada is no different from any other country. At this current rate of spread, our health system will be tested to the max. Will be tested to the max. I cannot think of a better team I'd rather have for that test. But unfortunately, for that team, these are going to be very dark and difficult days ahead of us. But the team will come through. Let me say again, I cannot think of a better team to have than the team we have now. Whatever our challenges are, this is the right team to get past it. Our nurses, our doctors, our administrators. This is the right team. We will get through this together. We will lose some of our loved ones in the process. We will lose some of our loved ones. But we will continue, as Grenada always has. We pick up the pieces and we move on. We did it in Ivan. It's no coincidence. Today is the anniversary, celebration, remembrance of Hurricane Ivan. And we can all remember what we felt when we woke up that morning after. We haven't got to our morning after yet with COVID-19, but we will. We are in not even the eye of the storm as yet. But the storm is upon us. So, members of the public, please, we need to work together. All of our stakeholders, those who have been giving us support, and those who are yet to, the many individuals who have come forward and said they're volunteering their services, our various social partners who are coming forward, and we're all speaking as one as to what needs to be done, the support and encouragement for the vaccination process as well. So these are the things that will get us through. If we fight among ourselves, we will increase the casualty and the damages from COVID-19. If we come together and support our health system, follow the instructions of our healthcare providers and recognize that they too are experiencing challenges, then we will minimize the damage and loss as best as possible. Thank you.
Thank you very much, Minister. Before we go to questions from members of the media, I just want to take a quote from the Prime Minister's most recent national address, in which he stated, "This crisis is not insurmountable. As a people, we are battle-tested and resilient. We can and we will get through this together." The key word there being together. And this is something that this entire administration has been saying from the get-go in terms of its approach. There's need for collaboration. There's need for all hands on deck to get the country and its people through this crisis. At this point in time, I'd like to turn to questions from members of the media. I note that we have questions from GBN, Callistra Faria, Richard Beadle, and Linda Straker. GBN, we'll start with you. Good morning. Please proceed with your questions.
Good morning, Rena Pierre Thomas from the Grenada Crossing Network. My first question, could the minister or any one of the doctors tell us what is the present state as it relates to manpower at the General Hospital? I'm also seeking a comment. There are reports that nurses who are asymptomatic or symptomatic are asked or requested to come to work regardless. First off, could you give me a comment as it relates to that? And could you clarify if out of any of our active cases, there are nurses or any health service workers? I'm also asking as it relates to persons are calling or saying that the Ministry of Health is requesting that you either call the nearest police station, the hotline, or for in case they have any flus or flu-like symptoms. But when they call the police station, the police are angry with them. And when they call the hotline, they're not getting an answer. So what is left to be done? There are persons home presently who have flu-like symptoms or think they have the COVID-19 or think they have COVID-19, but upon calling, or if they do get through, they've been home for days and weeks without anybody coming to see what the case may be, or so they don't know what to do or how to go forward. The Bus Association would have recently sent
Rena, can I stop you there? I think we've had 3 questions thus far. Let's allow the panel to address these, and then we'll take further questions.
So first I will address the fact that you're asking about the staff. Yes, we have nurses, doctors, housekeepers, groundsmen, security, laundry. Every part of the hospital department has someone that is positive, and they are at home isolated until they are able to come back to work. We have not asked any of our employees, and we don't have any employees that are expected to work, whether they're asymptomatic or symptomatic and COVID positive. That is not something that is being done. It has hit across all of the staff, but however, we continue to reach out to have relief, and that puts it onto the next colleague to do the extra that is necessary. So we push. We can't stop. And as Minister Steele has said, we have to keep pushing. We don't have an alternative.
Dr. McIntosh, read the status of manpower at the hospital. I think that was her first question.
So as it relates to the manpower at the hospital, when you're talking about for the doctors and nurses that are able to oversee for the isolation wards and making sure that they manage the COVID patients, as it relates to the ancillary and auxiliary staff, of course, we've always understaffed, but we continue to provide as best we can across the board in all the services.
Thank you very much. What about the question that speaks to the hotline? I know this question has come up time and time again.
Yeah, let me address that. The hotline, we have added additional people as the cases increase exponentially, so too do the number of calls. There are changes that are being made today with that in terms of a significant number of additional persons, especially, and I want to thank them again, volunteers who have come forward, and also a changing and structuring of the options, as you call the hotline. So in a nutshell, there would be certain specific symptoms that are considered to be serious, life-threatening, that if you exhibit those, and you will be directed from the hotline directly to medical personnel. And then there are other minor symptoms, and also what we've seen, the majority wanting to report a possible exposure or seek additional information from an exposure and case monitoring. Quite a few people who are positive want to just call and find out number of days left, or will they be tested, or should they just wait out their 14 days? And so those calls will be directed differently. So that should be fully, if everything goes according to plan, should be operational fully this afternoon. Or at least you should begin to see the effects of that additional manpower and redirecting of those calls based on where we've seen the load. That is based on the current situation. We will consistently evaluate it day by day, and wherever we need to adjust, we will as this national situation develops itself.
Thank you, Minister. I think we ought to be cognizant too that at present there's more than 1,000 persons in isolation who could very well be suspected COVID-19 positive cases. So by that figure alone tells you the number of persons who could very well be trying to reach the hotline. We have indicated the system is overwhelmed. That's not to undervalue the need for immediate care, but there is need for some understanding about the limitations within the current system. Rena, I think you had some additional questions, but I had to stop you. If you have one or two more, please go ahead, and then I go on to your other colleagues.
Yes, I have another question. The National Bus Association would have issued a press release earlier on today asking bus operators to pull their service from tomorrow. I don't know if the minister would have seen this or any one of you, but could you tell us if there would be any plans or anything put in place to assist the workers or the essential workers to get to work, especially those who would use the public transportation?
There are plans within the hospital and health sector. I know that we have put our contingency plans in place to transport our workers. All I would say to whatever I'm not aware of a decision made by the bus association or so, but I would say to them, like I would say to anybody else, now is a time for us to unite. We need to get through this together. Any attempts to put additional stress on the system when the government and people of Grenada are at their most vulnerable point is not practical, is not patriotic, is not realistic, and will not help this situation.
Thank you very much, Minister. Rena Pear, we'll move on. If you have further questions, we can come back to you later. Kalish Trafaria, good morning. Please go ahead. Kalishtra, are you there? Okay, we don't seem to be hearing Kalishtra. I'll move on to Richard Beadle from Vibes FM in Carriacou. Richard, good morning. Please go ahead.
Good morning. Thank you. Are you hearing me?
Yes, I can hear you. Please proceed.
Okay. First of all, I want to say, extend our condolences to the family of Dr. Ray and the medical fraternity as well. I have 3 questions. Firstly, could you give us some statistics specific to Carriacou and Petit Martinique? We did get the numbers as far as percentages are concerned, but if you could just let us know the specific numbers of positive cases that have been identified in Carriacou and Petit Martinique, and some details as far as whether who are the numbers that are asymptomatic or mild or having serious symptoms. My second question is relating to the hospital and the limitations of the numbers of beds and the numbers of ventilators that are available for those hospitalized. And I guess this is speaking more to just giving our listening public a deeper understanding of the prognosis as cases increase. And, if there are severe cases and hospitalizations that need to happen, we see in other countries where, what happens when the hospital is inundated with an overwhelming number of cases and there are not enough beds or ventilators. What are you seeing down the road for us, for Grenada in general, and then specifically for Carriacou and Petit Martin? What kind of process is in place? If we should have the need for hospitalization or serious hospitalizations, how do we, being away from the mainland, what kind of process is there? And I ask this question within the context of, I guess, helping us to understand the reality of COVID-19 and the need to acknowledge that it's actually here and follow the protocols, and understanding what we're really up against if we don't protect ourselves and each other. So those are the questions. Thank you.
Yeah, with respect to the distribution of cases or number of cases from Curfew, as of 5 o'clock yesterday, 14 of our current active cases are from Curfew. With respect to whether they are symptomatic or asymptomatic or any of the symptoms being experienced, no, I do not have that breakdown. Simply to say that as of 5 o'clock yesterday, 14 positive cases for Curfew. Now, I cannot confirm as to whether that's just Curfew or Curfew and Petit Martinique, but I can provide that information, and we will release from here on now a breakdown between Grenada, Curfew, and Petit Martinique, number of cases, etc. The other questions with respect to how are we going to treat the situation in Curfew, and Dr. McIntosh can add to that, but in essence, the policy and the decision is that the timing or the decision to transfer a patient to the general hospital from Curfew is made much earlier. But I know Dr. McIntosh and the team had meetings, so she can give you some more information on it.
So as it relates to COVID-19, we want to make sure that we understand that COVID-19 is a disease primarily respiratory. And approximately 80% of people who are positive for COVID usually have mild symptoms. So, of course, the larger the number, the percentage that have further symptoms increases. As it relates specifically to Curfew, we're continuously monitoring all of the patients who are positive. And you look for particular signs that would show, are they worsening? Are the signs increasing? If that shows up, our threshold is lower, and we allow for them to be transferred to Grenada. So we allow for them to be coming into Grenada sooner as opposed to later, and allow for people need to understand that even if you're at home, monitoring yourself, monitoring what's going on with your symptoms, and having that interaction back and forth. And if you're feeling worse, do reach out so that we can make sure that we identify and bring people in. In relation to, Minister, do you want me to talk about the ventilators as well? In relation to the ventilators, again, COVID-19, if you are further on in your symptoms and have further respiratory symptoms, the best is not to intubate. Now, we know this from all of the other countries that are moving forward. So the first line is to try not to intubate, which is what the ventilators are for. We do the high flow oxygen, which we're able to do that across the board, and giving the medications and support, and having the person prone, meaning laying on their stomach. If they are worsening and require ventilation, we have the ventilators that are present. We have at least, if we want to talk about the numbers, 12, and if necessary, we can find more present at this present time with the COVID patients. But again, the transfer or the treatment is to not to ventilate if not necessary. And I agree, and I'm so glad the minister points out, the team that is present is capable and able. And I'm not saying this just because of the fact we're in Grenada, but because of the fact that we can compare it back to we're in the United States and moving. And everyone is staying on top of that. Medicine is medicine no matter where you are. The capability of physicians are present, and that's what's present here. And they're pushed with the physicians and nurses are present here. The supplies that are necessary, we have the supplies in. We have the oxygen that is in. Even in the larger countries, there's a question of how do we maintain. We try to stay one step ahead in maintaining. But we do have the ventilators that are necessary. We do have the oxygen that is necessary, but we have the protocols that are in place that hopefully keep the person from moving towards ventilators. But if it's necessary, they are present.
Dr. McIntosh, before we take the next question, I'd just like you to quickly explain why ventilation is like that last resort.
So the way that COVID-19 affects a person, you would imagine that even if you're not a smoker, that your lungs become like a 30-pack a year smoker, meaning that you've been smoking 3 packs a day, so that your lungs start to stiffen and harden and makes it more difficult for you to expand it. So one of the things that you started with, the high flow, is to push the oxygen in to allow it to continue to expand. You have them prone as opposed to on the back, allowing for more expansion. But you don't want to get to the point of the ventilator, because the ventilator now, of course, says Instead of you using your own lungs and your muscles, we're doing it for you. So that's the risk that would occur, is that once you go on the ventilator, you may not come off. And then the long-term effects that would occur with that. So this is one of the things why they do not want to ventilate a person. They prefer that we try with the high flow, as well as being prone, as well as giving the medication, as well as cupping. So you're doing all the different things to help the lungs to expand, to help to push out the disease, in simple terms.
Thank you very much, Dr. McIntosh. Linda Stryker, we'll come to you now. Good morning. Please proceed.
Good morning to you and the panel. First, let me express my condolence to the families of those who have died. I have quite a number of questions, and my first question is: on Saturday, the police would have told us that the force is significantly affected, based on the numbers of officers who are currently infected. Can Dr. McIntosh or the minister share with us possibly the number of healthcare workers who are affected by COVID, and how that has affected the healthcare system in overall? What type of pressure is it facing? My other question has to do, in Parliament on Friday, the minister made mention of the cost of PCR and other tests. Can he share with us this morning the cost of PCR, how much the government has spent so far on testing for COVID, both for rapid as well as the PCR, and the tests that are comes into the country, how is it acquired, and how much do we currently have in store? Because I realize that we're going on the massive vaccine testing, not vaccine, COVID testing. We have massive testing taking place. So how much COVID tests do we have in store? And my third question for now, because I know we're going to come back, the person who died in the community at home, can they share with us whether or not that person was in isolation after knowingly being tested positive, or it was a case of getting to know the status after the person died? And is government considering or already adopted a policy of testing persons who have died at home for COVID-19 to ensure that it was not a COVID-related death? I do have other questions, but I await answers for these.
Well, Linda, I'm going to try and take the questions because you sort of came with a rapid fire there, but let me do my best. In terms of cost of COVID-19 tests, we have been releasing those figures. At last count, we were close to $17 million in terms of all of our tests, reagents, the machines, etc. And so the number of tests currently, PCR tests, I can give you a straight out answer, but let me explain a bit. PCR tests in particular, it's a chain of various things that you need to make sure you have enough of each. So me telling you the number of reagents and telling you that we can do over 300,000 tests there is not the realistic picture. That's how much reagents we have and how much tests can be done at the lab. But each of those, the sample needs to be taken from that nasal swab. So that is right now where we are at our lowest numbers within that system, and that is 17,000. So we have the ability to do 17,000 PCR swabs, so that means 17,000 PCR tests, although we have much more reagents, etc. So yes, there are more swabs on the way that will allow us to continue the constant flow, but in general we try to keep that sort of buffer within the system. It gets tested at times like these, where we are seeing a significant drop and have had to make sure that additional orders and emergency orders are placed, is in the rapid tests. As you're very much aware, we have shifted and are using considerably more, almost 1,000 times more rapid tests over the last week and a half. So that also has to be increased. We have in the past, when we did not have a high demand, we have shared some of our tests with neighboring islands when they were in their time of need. And we are also requesting from them just to make sure that we keep that buffer in place as best as possible. What your other question with respect to PCR? I hope I've covered your concerns with respect to PCR. The COVID death, yes, there is a policy implemented or instigated by our Chief Medical Officer that all persons within the community now or all deaths are tested for COVID-19. And the individual who died, I am not, I will confirm with the CMO as to whether they were already on our list as a confirmed COVID case in isolation. I do not have that detail, no.
Okay.
It was? Okay, Dr. McIntosh is telling me. Sorry, Dr. McIntosh.
Yes, the person, and again, trying to have respect for the patient and the family's privacy, was positive, and we knew that he was in isolation and was moving towards being advised to be admitted to the hospital and decided to stay at home.
Thank you, Dr. McIntosh. I think there was one other question relating to the number of healthcare workers affected now and how has that impacted the healthcare system?
So we're going with healthcare workers, and we're talking about frontline workers. So across the board, doctors, nurses, as well as the auxiliary and ancillary services. At this present time, we have over 60 plus people who are at home tested positive for COVID and in isolation in various states, whether it is 2 days at home going towards the 14 days. How does that impact? It does impact because it's where you're going to have a person that is pulled out. What we are doing, especially now, is, which is why you're hearing that we are not having outpatient department. The clinics are present. We're lessening the amount of services that we're able to provide, as well as increasing the amount of time, so 12-hour shifts that we're allowing. So for those who are in the auxiliary and ancillary, that would allow for them to be able to provide the services with a lesser number per day, and then also allow for them to rest in between. For the doctors and nurses, the same thing. We're putting less services in and going more on emergency services so that we can pull people in as necessary to provide the immediate services that are necessary. We're not stopping services to people. We keep talking about COVID-19, but remember, we have our regular admissions, patients, deliveries, emergency surgeries, which will continue. I do want to step back and talk about COVID-19 is present. As you heard the Permanent Secretary talk about, over 80% of the people who have been hospitalized are not vaccinated. We need to talk about what are the tools that are present that are here for us. Vaccination is one. Vaccination, there's no question, is not if, it is evidence-based, has shown that if you are vaccinated and still get COVID, you're less likely, remarkably less likely to be hospitalized, remarkably less likely to have a severe disease, and of course, remarkably less likely to die. So that is one major tool that is present that we are able to offer to people. And we need to, again, talk about the fact that, yes, becoming isolated, if you're positive, staying healthy, we talk about all those different things to do, taking your medication, taking your vitamins, as well as staying healthy with whatever comorbidities you have. We say comorbidities and positive, but even a person who is not vaccinated, no comorbidity, and gets the disease, they're more likely to be hospitalized as opposed to someone who has comorbidities, vaccinated, and gets positive. So when you see what is the differing factor, it's vaccination. So we need to look at that and really implore to us, how do we maximize? When we go against a battle, bring all your tools. Being healthy, staying healthy, keeping whatever disease you have under good control, but first and foremost, if possible, getting vaccinated.
Sure, P.S., you wanted to add something. You can go ahead.
Yes, I just wanted to add, because we speak a lot about the hospital services, but community health services are also impacted by our healthcare professionals being affected by this disease. And our community nursing department currently has 13 nurses that are being affected by the disease and cannot be able to provide service at this point in time. And that also has impacted the community health services and resulting in us have to take some actions there as well in order to continue the services within community health. What persons would be seeing in the week ahead is that we have to scale back on some of the services that are offered within community. So our maternal and child health service, vaccination program, our pharmaceutical services, we are now looking at how do we merge some of these services together. So whereas persons used to access these services on different days, we are trying to merge these services so that when persons go to the health service, to the health facility by appointment, on the day given for your appointment, you can access several of these things one time. And that would help with the exposure as well, because we don't want persons to be coming to the facility as often as they used to, especially our elderlies. So we also are putting some systems in place as a result to have our elderly persons managed at home, persons with chronic illnesses. So we will be increasing their supplies, like the medication and other supplies that they access at the facility, which would reduce the number of visits they have to be making to the health facility, as well as allowing the limited staff that we have to be able to serve the community. So the public will be seeing that in the days ahead, and we are seeking their understanding and patience as we roll out these adjustments, because we have one team, and that team have to continue to operate with our normal services, as well as that team has to continue with the surveillance mechanism that we have in place for COVID-19. So we have to make adjustments in order to be able to carry out every aspect of what we provide. Our surveillance teams are outside, and as a result of that, because of the limitation again, we have to revert to going into providing access to testing and vaccination within the community on different days. And we can speak of that a little bit later.
Thank you, P.S. Julian St. Paul. MTV, good morning. You can proceed with your questions. Oh, I'm sorry, MTV, before we come to you, I think Nancy McGuire was first, so we'll take her and then we'll go to MTV. Nancy?
Yes, thank you. Good morning. Are you hearing me all right?
Yes, Nancy, we can hear you. Please proceed.
Last week, we were told that there were 23 beds, including the available ones and backup ones in the isolation unit. So now, with 25 in the hospital yesterday, what are our plans for more beds? And is there any involvement from private hospitals in this fight in terms of isolation units? And with the increasing cases in the Royal Grenada Police Force, we were told that they were collaborating closely with the committee and the ministry. And I'm wondering if any changes have been recommended in terms of the living quarters at this police stations. And finally, are any of the cases, or do we know that any of the cases admitted of the elderly are from nursing homes? Thank you.
So I would just address the actual number of beds. Yes, we recognized before that we had the one isolation ward, and what we did, recognizing the fact that the numbers are increasing, we had to convert the lower level of the general hospital to our isolation ward. We had to move our pediatric ward upstairs into another ward and distribute our patients accordingly, so that we would have the entire floor. And as I stated before, that can allow us for a maximum of 49 beds. And if necessary, we can increase that further. So we have increased our number to try to just stay at least one step ahead in preparation for if there are any need for hospitalization. And to how to decrease that hospitalization, as you hear the permanent secretary talking about, in the community. How do we make sure that people stay healthy, get vaccinated? If you can take care of your comorbidities, because that's the majority of people that are coming in. Not ones, hopefully we have not had them get too critical because we're monitoring them. But those who have other comorbidities that are out of control, their diabetes, hypertension, and being positive, requiring hospitalization to stabilize that while they're positive.
Let me add to that with respect to the rooms. There is a phase 3. We are now in the phase 2, which when we prepared the first ICU unit, the 15 to 22, now that we are seeing that maxing out. We have gone to the lower level, which is approximately 47, and then the phase 3 would be to either take on another floor and move services to Princess Alice, or have Princess Alice completely be COVID. So it's going to be one of those, but it depends. The reason why it seems like there isn't a final decision, it depends on the stress on the other sections of our hospital services and community services that will dictate what moves to Princess Alice as we try to accommodate the additional cases within the system. Another thing that I just want to add before you go on, Nancy, and it is related to, and I will ask for it to be set up within the next day or two. It exists everywhere else, and we need to be honest to the public and say it is time now that we put this in place, but hope that we never use it, which is referred to as an ethics committee, which is a group of individuals that will decide when the hospital gets inundated, who gets let in and who does not. We do have to have that set up. I do hope that it's never used, but some of the individuals here are going to be part, or asked to be part of that committee. It's a difficult decision, but I do believe as minister, while I never want to use this, and I hope we never get there, we need to make sure that all contingency plans have been put in place.
Thank you, Minister. I think there's also a question from Nancy in relation to the involvement of private hospitals and providing isolation units.
So private hospitals, I want to say private hospital that we have in our area, who has been very supportive. They support in whatever ways that they're able to. When we talk about isolation, if a person requires hospitalization, that means that they have more symptoms and they require the intervention. So as Minister Steele has pointed out, our primary place is the general hospital. That's where it has the intensivists, that's where it has the imaging, that's where it has the operating theater, that's where it has the maternity, our obstetricians. So even though we have hospitals on the outside, it's not necessarily that we would want to keep patients further away. We would like to bring them into the one area where people that's where they're directed, watching the COVID patients, and if they are in need of additional services, then we're able to provide it. The same reason why we're bringing people in from Caracou to be transferred across. Minister, you're correct in the sense that you need to look at all of that. Someone asked about the nursing home. We have patients that are positive in the nursing home but do not require admission. And they have been isolated to make sure that they do not spread abroad. But that tells you how rampant this is and how it is necessary when we say no visitors is to try to keep the disease from spreading and making sure that if you are feeling the symptoms, please do not go out because the most vulnerable are the ones that are most affected.
Okay, there's another question from Nancy relating to any recommendations for changing in living arrangements for police officers.
A decision that the Commissioner of Police and his senior administrative team will have to make. I know that we have worked together on accommodations and facilities for persons in remand, for some members of the force as well. But basically that is a decision for the Police High Command.
Okay, thank you, Minister. We move on now to Mikey Hutchinson and then to MTV. Mikey, good morning.
Hi, good morning again. Are we doing double testing to make sure that the new method of testing isn't inflating the numbers? And if we are, have we identified any false positives or negatives to date? Also, how many positive COVID-19 cases have you identified to date at Her Majesty's prisons? And my final question, what happens to the body of persons? What's the protocol of persons who die from COVID-19?
Mikey, on your questions, no, we're not double testing. I think Dr. Mayana Charles and the team last week had explained it, I thought, in detail. The tests that we are using The rapid test, that is a standard protocol to shift to, and there is a policy for identifying. These tests are extremely more accurate than the early rapid tests that were coming out, and because we are in community spread now, we are allowed to use those for a faster diagnosis. You will see us switching in the communities between PCR tests and rapid antigen. So for instance, I think today at some of our sites, we will be almost 100% PCR, collecting samples and then delivering. That is just to keep up a balance with respect to the test results and to be able to confirm what your concerns are. But we're not questioning the accuracy of either test. We are confident in the accuracy of both of our tests. We are using two different processes consistently to make sure that we have a balance of PCR results as well as rapid antigen results in this diagnosis. But all public health systems recognize that at this point in time, where we are in this pandemic or spread here, that the PCR results are too slow to keep up with the spread of the disease. So you have to revert to a significant amount of the rapid tests. With respect to Her Majesty's prisons, the last count I had of persons in isolation were 10. I have not received any information otherwise, so I have to assume that is still the amount, but can confirm that. I think your other question I will pass on to Dr. McIntosh.
His question was, what happens to the bodies of persons who die from COVID-19? What's the protocol?
So the protocol that is for bodies that have died from COVID-19, it's not standard, it's safe to be cremated, but we allow for the fact that the funeral homes are cremating the bodies. They are done immediately, and if it's necessary, there's a concern about autopsy, etc., then that would be considered, and the pathologist would provide the autopsy prior to the removal of the body. Again, we move immediately because of the fact that we know most of the times the person is in-house. We know that they have COVID-19. We know all the different symptoms. So when people say, well, what was the diagnosis? We use what they had clinically to help us with the diagnosis. The autopsy would be if there's any additional questions that would be necessary. Our funeral homes are working with us on this, and people may say, oh my gosh, you're talking about cremation versus allowing for burial. Again, as Minister talks about, we have to look forward. We have to remember that we are able to look at what other countries are doing and what has happened there. If the numbers go up exponentially and the numbers of deaths go up, and being able to manage, it would cut to cremation to allow for us to be able to continue, be able to assist the family, as well as being able to keep the funeral homes moving forward with providing the service.
Thank you, Dr. McIntosh. MTV, we can come to you now. Good morning. Please proceed.
Good morning. Donella Houston here, MTV. Two questions. One is a follow-up to Dr. McIntosh's response to Nancy's question about the pediatric ward. Where is the pediatric ward being placed to know that it's being used for COVID patients? And is it healthy to place these children in this ward? And a comment on, we're hearing that there are COVID-19 patients on the wards among the other patients, regular patients who are not positive. Is that true? Is there any truth to this?
So as it relates to the pediatric ward was moved entirely up to where we would have held female surgical ward. Before they were moved up, we moved all of the patients in female surgical to the other female wards. We actually sanitized the entire area and moved the pediatric patients inside. So they are safely in there as another pediatric ward and even larger for them. As it relates to the patients being amongst COVID positive patients, amongst patients who are not COVID positive, that is not correct. They have maybe COVID positive patients that are on the ward who are isolated and separated from patients who are there who are COVID negative. and who are not positive. So it's not that they are amongst them. They are there until we're able to move them immediately into our isolation ward and kept separate, and we have the protocol that goes with that. Again, this is as we are sending people home and saying that they're isolated at home, and we have the particular things that we're saying that are in protocol for a person who is living amongst their family members at home, and keeping them isolated and making sure that certain things are not done together so that there is no risk of transmission of infection, and also protecting not only the patient, those that are around, but also the healthcare providers.
Thank you very much, Dr. McIntosh. We're just a couple minutes after 10. I lost the chat in the Zoom call, so I'm not sure if there were any further questions from members of the media, but please quickly indicate if you did in fact have further questions. We can probably take a couple more before we put a wrap on things. Okay, GBN has already responded. Rena Pear, please go ahead. Let's keep this round of questions to just one. Because we do realize that the professionals have to get back to work given the critical stage that we're at. Rena, please go ahead quickly.
Yes, Dr. McIntosh, could you please tell me how are the nurses expected to take care of those in the wards? Well, we understand that the space is a bit limited for a time. How are the nurses expected to take care of the normal patients and still be able to take care of the patients who have COVID-19 in the ward? Within the ward, I would see that there are those in isolation, those in the various wards, and they're short in staff. How is that working?
I'm glad you pointed out that they're short in staff. So we have been short in staff before COVID. So you would have 1 or 2 nurses taking care of 24 to 32 patients on a ward. So they have learned to be able to multitask. The difference now with the COVID positive patient is that when I'm going into the area where the patients are there, they would put on their PPEs, do all the different things that are necessary, and manage with the patients. And it's not just nurses, it's nurses and doctors and the nursing assistants, so it's everyone. So a COVID positive patient that may be on the ward is not one that is critical, that requires the constant care of being intimately there. They are kept directly in our areas of isolation as we can. The ones that are there, as I said, they have the comorbidities and are COVID positive. So they have the diabetes, the hypertension is what they're managing, and are COVID positive. So they are managing them as it is necessary, doing all the different things. The additional thing that they're doing is because they're in isolation, making sure that they have the safety, keeping the patient safety, providing the mask to the patient to decrease the risk of transmission, along with taking care of the patients otherwise.
Thank you, Dr. McIntosh. Richard Beadle, just one question, please, as we go through this round quickly. Go ahead.
Okay, thank you very much. With regards to mental health, we've noticed a reluctance in some quarters to acknowledge the reality of COVID-19 in Grenada, Carriacou, and Petit Martinique. There's quite a bit of deflecting happening, and in some quarters, people would point to this denial to indicate that it's a coping mechanism dealing with the stresses of the situation. There are all these stresses that are on the increase. Domestic violence may be increased, and then there's a situation of grief counseling for the families who suffer loss. So how is the Ministry of Health preparing to protect the wider community who are dealing with the mental health impact? And do you have any support from the psychologists and counselors to help stem the mental health response in Carriacou, Grenada, and Petit Martinique?
Thank you for that question. That is a real and pertinent question. Right now, our counseling services are engaged with patients, family of patients, and our health team. But yes, you raised the question, and let me say Grenada is no different, because we have seen, and my speaking to colleagues in St. Lucia, St. Vincent, Martinique, Jamaica, Trinidad, and the wider world, there are a significant number of our population that are in denial, even when COVID positive sometimes. And what worries us more or most in this, there are many levels on this, what worries us most on this is sometimes these individuals seek other forms of medication, home remedies, etc., and wait until it's too late to actually finally call on the health system or the hospital or the ambulance to get there. And at that point, there's not much that the team at the general hospital or in the community can do. And we have to find the balance there, because at the same time we're also saying call the hospital or the emergency line when you do need the attention, and we're setting up and making separations for just questions and reporting of serious side effects. So that part is what one of the parts I want to address, but then also on our very psyche. We've been fighting this war for 15 months. And just when many, if not all of us, have gotten battle fatigued, fed up and frustrated of the measures and sacrifices we've had to take, we get our onslaught. We are 2 weeks into we're 2 cycles, into what we can refer to as our carnival outbreak. And we have to be our neighbors' keepers. You are right, there are individuals out there who are under significant pressure. Mention was made of our bus drivers. I don't think that their complaints are not legitimate. Definitely not. All I'm asking is that we do not pressure the system, and we work together. That's not me saying that you don't have a legitimate call, but now is not the time for strike. Now is not the time for militant action. Now is the time for compromise and working together. Does not make your plea, your concern, your plight less. It is just a time for compromise and working together. That's what I'm saying, and our churches need to do their part, and they are, in giving support to. We are people of faith, and it's not just the government and the ministry, and I'm not saying that it has been. I'm recognizing that all of these other entities, in particular our churches, have been doing their part as best as possible to give support. So that's my response to that question, but I think Pierre St. Paul wants to add to that.
Yes, I would like to add. Initially, in our first phase of this whole pandemic, we would have partnered with the Ministry of Social Development in order to assist us with the psychosocial support aspect of this whole plan. And again, I must say that we have since reactivated that action plan for psychosocial support between the Ministry of Health and Social Development, because at this time we realize that psychosocial support is a critical aspect, not only for our patients in allowing them to accept the disease and the disease pattern, but also our health team, family, friends, and the community as well. So our action plan for psychosocial support, partnering with the Ministry of Health, has been activated, providing the support to persons who have been tested positive, and also to our health team that is out there in the field, providing the testing services and all that is needed, having to go through the process of witnessing death day in, day out. So we know and we understand how important the psychosocial need of our whole team, and that includes our patient, is, and we are treating with that.
Thank you very much, P.S. Nancy McGuire, your final question. Please go ahead.
Yes, thank you. It seems that the number of second doses is increasing. With that, in a more positive note, do you have any projections when we could reach herd immunity? It seems more people are responding now that we're in this dire situation. Thank you.
Nancy, yes, there are 2 things contributing to the increase in second dose. One is a lot of people who were hesitant with the AstraZeneca didn't come for the second dose, or so are coming forward now. And 2, remember the Pfizer is 21 days. So the space, the timeline between first and second is a lot less. And obviously three, that we all know that we have friends and possibly family who was saying, I have nothing against the vaccine, I'm just not ready to take it now, and many people are now ready to take it. So that's why we're seeing that increase and that narrowing of the gap between first and second doses.
Mikey Hutchinson, final question.
Okay, there's a Minister, still a big, beautiful hospital in Guelph. I'm wondering where does it fall in this whole pandemic, whether or not there are plans to use that hospital or why it has not yet been in use.
Mikey, that's a good question, and I will have an answer for that by end of today, that facility has to be used at least for testing and vaccination at best. And PS and I spoke about it yesterday, and we will have that up and running as quickly as possible as well.
Linda Straker, your final question.
Thank you, Philo. My final question is, a few weeks ago, the minister would have informed us that a few samples were sent to CAFA for analysis. Can he tell us what is the result and whether or not indeed we do have only Delta or we have a combination? And we are now hearing of a different variant, Mu. What is the variant that is circling in Grenada right now?
Linda, two forms of confirmation, and Dr. Charles Sean Charles had alluded to it, as well as Mayana Charles. Yes, it is Delta variant, based on the samples we've gotten back from CAFA at present. The existence of any of the others, like Alpha or so, we're not paying much attention to, but there are one or two mixes because Delta is the most contagious and the one that we should be very concerned about. So that is what is here, and we can also confirm it as well, as Dr. Sean Charles had said, based on the rate of increase of patients.
MTV, Donella, the final question, comment to you this morning. Please proceed.
My comment, just for point of clarification, I think the minister may have spoken of the Bus Association's decision to pull services. It is not, I don't think the purpose of this is a strike. I think that they are saying due to the concerns of their health as well as their family's health, they are worried about transmission, and they are trying to do their part in reducing the spread of the virus. So I'm just, because I think, was it week before on post-cabinet, the authorities did indicate that they were not reducing the number of passengers on buses. This has not proven to reduce the spread of the virus. So I think the Bus Association is doing their part, or trying to do their part, not to put pressure on anybody, but to basically curb that spread in their own way. I don't think it is a strike, you see.
I want to thank you for that, because the way I'm not privy to any decision that the Bus Association has made. But the way the question was framed is the way that I can answer. So in terms of withdrawal of services also, but the way you have described it, that is most definitely a legitimate concern, not just of bus operators, but most providers of in the private sector, of which the Bus Association is part of. And I know they were present in meetings with the private sector that Prime Minister held recently, and so there's discussion and dialogue. So that is my comment and position on it. Regardless, this is not the time for withdrawal of services in protest. This is the time to consider the safety of yourself and your family. This is that time, yes. And if that is the position that any association, bus association, or any other association is taking, that I cannot fault them for. And in fact, to an extent, I would say let us discuss and find ways to do that safely and to the benefit of all. Definitely. We don't want knee-jerk reactions, but it is the time for coordinated measures that will keep us all safe. That's why we have put these regulations in place. But it is most definitely productive when different entities or groups or stakeholders come forward to and say, as we have with the Conference of Churches, I met with them as well. The Conference of Churches came forward, as well as the entertainers, restaurateurs came forward and said, listen, we understand, and this is our proposal of the sacrifices or measures that we are prepared to take. In some instances, it is totally in sync with public health measures. In some instances, it was and is necessary to go further with those. But it truly is beneficial when we still come together and try to solve it collectively, as opposed to government on its own, just putting measures in place.
Thank you very much, Minister. As we begin to put a wrap on things, P.S., I'll come to you first for your closing thoughts and comments this morning.
Thank you, Phil. I just want to remind us all that when we look at the statistics, we are seeing that 84% of the persons affected with COVID-19 falls within the age group of 18 to 60. And that means that is our workforce, our breadwinners, our caregivers. So if we continue to see this happening, we can understand the effect that it would have on our country, our homes, and our families. I just want to encourage us all to continue to take care of ourselves. We should continue to eat healthy, which helps to boost our immune system. Exercise, because that also enhances our organ functions. We encourages you to get vaccinated. Vaccination assists us with reducing the disease severity on each and every one of us. So we just want to continue to encourage our population to practice these three things as we continue to boost our immune system, and at the other end of it, continue to follow the protocol, our mask wearing, social distancing, frequent hand washing of our hands, or proper hand hygiene. The Ministry of Health continues to do all in its power that we can do to save lives. And we ask of each and every one in the population, we beg today your understanding, because we can reach so much at one point in time. So it's not that we are neglecting anyone, but we have to prioritize as we go along. So we continue to beg your understanding, and we are here to support you in every way that we can.
Thank you very much, P.S. Julian St. Paul. Dr. McIntosh, your final thoughts, comments this morning?
Well, I always say repetition is necessary. And I repeat and utter support both the Permanent Secretary and the Minister Steele in the fact that we need to make sure that we work together to battle this disease. One of the key things, as we talk about the face mask, hand sanitization, as well as social distancing when you're able to do so, and vaccination, because of the fact you are one of the people. We want to make sure that we don't spread this disease. We want to make sure that it actually is hit and we stop and curb the spread of it. But in addition to that, if you have an illness, if you have diabetes or hypertension, take control there and make sure that it is under well control so that your body will be able to fight off the disease. And if you don't have the disease, continue making sure that you stay healthy. We are all in this together, and I want to emphasize again hospital services, health services in the community as well as at the hospital, we too are part of the human race. We too are part of Grenadians. We're not separate in not having the disease. We're not separate in not feeling the emotion. So when you hear about the deaths as well, that impacts us because our Hippocratic oath is first and foremost to do no harm and to do the best that we can. So you can imagine how it hits doctors, nurses, even our healthcare, our frontliners when someone dies, because we wonder, what could I have done more? So please be patient with us. We are understaffed, yes, but we're doing our best. Be patient. We never know what may happen next. Help us all. Help each other. When we ask you to isolate, do isolate. When we ask you to get vaccinated, please come out to get vaccinated. Talk about the face mask, hand sanitization. We can't say that enough. We cannot say that enough. Continue to do so. And I wish that everyone would be healthy and stay healthy, and as well as our family members.
Thank you, Dr. McIntosh. And as per usual, Minister, the final words of the morning belong to you.
Yeah, thank you, fellow. We are in the second cycle of this outbreak. That means that the persons now being infected are from secondary infections. The first wave was from the series of mass events, etc., and it was a very severe wave, which speaks to multiple events and not one. Very severe wave in terms of how quickly we got from zero to the hundreds. This is exponential. So it's exponential to seventh value. 1 infects 7. So we can expect that sort of increase. And I know a lot of people are saying that maybe there's too much gloom and doom, and I'm speaking too much gloom and doom. I'm trying to be as realistic as possible. I'm not negative. We intend to get through this, and we will get through this. By no means have I given up, or any member of my team. We are not going to give up. We will get through this, but we want to be realistic in our communications with you and to prepare you for the worst case scenarios, because we are prepared for the worst case scenarios. And we need you to help us to get the message out there that if we do not make the necessary adjustments, if we do not get to that level of vaccination, if we do not respect the fact that this is a deadly, rare disease, and if we do not come together and work and fight it as a community, we will get to those worst case scenarios. And we would have done it as a nation. And finally, I see it, well, 2 more points. One, I have never been more ashamed to see the Grenada flag flying as I have watching it this weekend, knowing that there is death here in Grenada from outbreak of carnival, unofficial, unsanctioned activities. To see some Grenadians supposedly proudly flying our flag in New York, doing the same thing, participating in another country, to unsanctioned, unauthorized activities, flying the Grenadian flag. And what was more insulting, there is a picture circulating, and I think it does depict what it has done to us as a people, that the flag is so sullied and dirtied with old oil. And this person somehow is representing us as a nation now, while we at home are fighting to overcome and survive the damage and destruction that was unleashed from the mass events. We need to speak to that. Those are our fellow brothers and sisters as well. And we need to embrace them and help them to come to terms with the consequences while we ourselves deal with it. So that is one issue for us to deal with. But at this point in time is to end the same way in terms of recognizing those on the front line, those who continue to give service. Last night at the General Hospital, there with Dr. McIntosh, Dr. St. Paul, Pierce St. Paul, Nurse Telesford, passing Dr. Donald, and most nights this week, passing through various wards and casualty in particular, and seeing our frontline individuals, continuing to provide the human service, seeing some of them, most of them, all of them preparing for further impacts of COVID-19, while seeing the others, the nurses in maternity, having just delivered, because life goes on. And in pediatrics, settling into a new location, not the ideal location, but a new location. All of them. And then also to recognize Dr. Ray, who would have been providing extreme and human service to, as he always did. I just want to share one thing with the public to tell you the type of person Dr. Ray was and the kind of service that he gave to his country. The information I've received is since Dr. Ray's internship, Dr. Ray never took vacation. That's the type of doctor he was. And that's why his loss is so significant to us. So keep him and his family in your thoughts and prayers. And all of the other doctors and nurses and nursing assistants and orderlies, ambulance drivers, security in the hospital and in our communities who are at the front line of this medically, and our police officers, law enforcement, those who are at our ports, those who are simply being called out to keep us from hurting ourselves. And then those who are there to help us if and when we have been affected by this disease or anything else. So keep them in your thoughts and prayers, and recognize that as challenging as it is to the rest of us to deal with these circumstances, these limited hours of movement, etc., and the stress that it puts on us all, they have to come out. They still have to come out. And as much as we avoid the COVID areas like hospital, and so they're the ones that are there, looking after our loved ones. So I want us to always recognize them and the one fallen brother whose services we will miss. Thank you.
Thank you very much, Minister Steele. And now it's time to put a wrap on the morning's proceedings. We have to acknowledge that this pandemic is very real. Its impact is very real. We are only now experiencing firsthand what many other countries around the world have been dealing with for several months. We are late to facing the real magnitude of that battle, but we are facing it head on. The frontline team is continuing to lead the charge. And I want to include a quote here from the Prime Minister again in his last national address. He said, "The pandemic has created a financial and emotional roller coaster, straining the human spirit to near breaking point. The fatigue is inescapable, but our frontline team continues to deliver daily. I salute them for the human service being provided in healthcare, national security, and other areas of critical importance." So the words of the Prime Minister offering kudos and support to the frontline team in all areas. The pandemic continues to evolve and the situation is dynamic. And as a result, government will continue to review and revise its policies and procedures. The guidelines that exist today may not exist tomorrow because we have to continuously discuss and see what changes can be made as we seek to best address the situation. I just want to issue a reminder at this point that our daily curfew is in effect at 7 p.m. and ends at 5 a.m. daily. And this coming weekend, no movement days from 5 p.m. on Friday to 5 a.m. on Monday. Testing and vaccination will continue during that period, and persons will only be allowed to move for those purposes. I am Philomena Robertson. I thank you so much for joining us this morning, and we look forward to seeing you again. Until then, stay safe.